So welcome to the webinar, Balancing National Unity and Global Solidarity in Responding to the COVID-19 Pandemic, a conversation with Dr. David Nabarro, Special Envoy to the WHO Director General on COVID-19. Thank you to Dr. Nabarro for his availability and willingness to share his wisdom with us. And thank you also to the DUCIGS and your organization for making this possible. I'm Giovanni Zanalda, the director of the Rethinking Diplomacy Program. This event in particular is a part of a series on science diplomacy, which I co-organized with Professor Bill Pan and Mr. Chris Lara, who is a UN diplomat and Rethinking Diplomacy Program Fellow. I also want to say thank you to the Trent Foundation for supporting this initiative at Duke. Mr. Lara will introduce Dr. Nabarro, then Dr. Nabarro will provide his remarks, and we will follow his remarks with a conversation led by Professor Pan, Mr. Lara, myself, and we will get questions from the audience through the Q&A function. So please use the Q&A function. We will ask Dr. Nabarro your questions. We have 1 hour. The event is going to be recorded. So thank you very much again, Dr. Nabarro. And Chris, you may want to introduce formally Dr. Nabarro. Thank you.
Thank you, Giovanni. Hello, everyone. My name is Christian Lara, Rethinking Diplomacy Fellow. I'm part of this team organizing this event. And since you all have access to the biography of our speaker today, I will just briefly say that he's an inspirational leader who has spent 40 years working on health, from clinical medicine to development to global diplomacy, becoming a broker of consensus among actors in the realm of global health, nutrition and food security, climate action, and the Sustainable Development Goals. He is currently the Special Envoy, WHO Special Envoy for COVID-19, and co-director of the Imperial College Institute of Global Health Innovation at the Imperial College London, and Strategic Director of 4SD, which stands for Skills, Systems, and Synergies for Sustainable Development, a community of practice helping global leaders to develop the kind of leadership that is required in this decade of action towards the year 2030. In September 2014, the Secretary General of the United Nations appointed him as the Special Envoy for Ebola, and as such, he galvanized support for affected communities and countries. During that period, I have the privilege to work with him during the first and only UN mission for health emergencies, UNMIR. And because we have so many students and professionals in the audience, I will ask Dr. Nabarro to spend a couple of minutes sharing with us briefly a few insights from the beginning of his career after his graduation and his work as a young medical doctor in the Middle East, Southeast Asia, Africa, and Latin America. And I'm asking so because I have in mind the words of Sergio Vieira de Mello, which is another UN great inspirational leader, who always said that the diplomacy as such starts at field level, where the UN and the United Nations gets its legitimacy. So please join me to welcome Dr. Nabarro. Thank you so much, Dr. Nabarro. You have the floor.
Thank you very much, Chris. Actually, I must say, when Chris contacted me and said, we'd love you to come and join us for one of our seminars at Duke, I was so pleased because I have such wonderful memories of working with Chris when we were involved in this response to the Ebola outbreak. Chris, you were an inspiration to me, and you still are. And that's important. People can't do the kind of work that I do without being connected and to find fellow spirits with whom to work and to relate. Often for a long period of time. Because in answer to your question, what was it that's held firm in my mind ever since I started my work as a young doctor, I just have to say that it's the values of the importance of every life. Every life matters, whether the person is from a poor country or a rich country, whatever the ethnicity of the individual, whatever the sex, of course, and indeed, every life just is equally important, whoever you are. And it's a really useful core value to have, because so much of diplomacy is about rating one group of people as being more important than another group of people. It's very competitive. But for me, and I think for so many of us working in public health, the credo is we're all equal. Of course, I've been hungry to try to support change ever since I started with this value set, because it wasn't enough just to believe in equity. I wanted to try to find a way to reflect those beliefs in my life. My career was never in a straight line. I always had to be ready for new opportunities when they came along, sometimes quite unexpected opportunities, and not to be scared of jumping into them, even if at the beginning I felt perhaps that they were stretching my capacities. I like to work at interfaces between disciplines, because I often feel that that's where some of the most exciting insights happen. I've always been frustrated with being locked inside a single discipline. Because of my values, I've sensed that people should be front and center of everything that I do. And I've liked to find pleasure from connecting people and seeing how through connection they can expand their horizons and find new ways of working. In my life, I've benefited from the advice and support of many mentors. They've shown me new doors to open, and sometimes they've picked me up when I've tripped and fallen over. I try to respect everyone, whoever they are, even if I radically disagree with them, because it is through those unusual connections that new things happen. I've got quite a tough temper. I get frustrated, and I'm trying to be careful with it at all times. It never works to lose it with somebody, but I also, because I do occasionally find that I don't live up to my own standards, I forgive myself, and I accept that doing the kind of work that all of us want to do, you sometimes feel that you're failing, and you have to be ready to forgive yourself and occasionally to be kind to yourself, even when you're not feeling that you're at your best. So those are some thoughts, Chris. I don't know whether they are helpful, but they reflect a little bit of my own journey. And now I'd like to talk about COVID, if that's okay.
Yes,
thank
you so much. Thank you.
And one of the things I try to do is to make presentations without using PowerPoints. That's because I feel that sometimes a PowerPoint slide can be quite distracting, especially when it's got a lot of text on it. And so what I will do is just to give you in advance the 5 headings that I want to use, and then you can check to see whether I'm following my own logic. I want to talk about the virus, this new coronavirus that causes the disease. Then secondly, I want to talk about vital steps that I believe need to be put in place everywhere in order to get on top of this virus. I want to focus on who is particularly affected by COVID and where they are, to try to get a little bit more precision as to the nature of the issue. I want to focus on some of the problems with narrative, what I call false choices and mirages. And then finally, and I think that's where we will concentrate, I want to focus on opportunities within nations, opportunities between nations to move through this current crisis in ways that thrive as a result of connections that can occur between stakeholders and people. So firstly, on the virus, it's a coronavirus. It's not a flu virus. It's not Ebola. Coronaviruses are not usually kind. And we've experienced a number of coronaviruses in recent years, particularly the one causing SARS in Southeast Asia, or MERS, primarily in the Middle East, but also elsewhere. And what we've learned about coronaviruses is they're rather stable, they're highly dangerous, they're easy to underestimate, they're stealthy, and of this particular virus, I want to stress, it's here to stay. This new coronavirus is not going away anytime soon. One of the reasons why it's not going away is paradoxically because it has quite a low fatality rate and is very easily transmissible. Everybody in the world is having to make sense of what this new virus means in their own lives, in their families, in their workplaces, in their universities, in government. And we're all having to do it at the same time. And we're having to do it very quickly. And it's not easy. So it's quite important right now to be very patient with people, as well as being patient with ourselves, as we come to terms with what this new virus means for all of us. Now to the vital steps. Actually, the steps taken to deal with this particular virus and the disease it causes are the same as what we use for any other infectious disease for which there is not a treatment that works for everybody. We have to put people front and center of the response. And by putting people front and center, it means enabling them to understand that it's their actions which will stop the spread of the virus. It most commonly affects us in our respiratory tract. It causes an inflammation at the upper part of the respiratory tract, around where I have my hand. By causing an inflammation, it actually creates irritation in the tubes at the top of our lungs, and that makes us cough. And when we cough, if we've got COVID, we transmit the virus in tiny droplets. Usually when we're coughing or singing or shouting or sneezing, the droplets only travel just around 3 feet or 4 feet, sometimes a few more, but usually if we're 6 feet away from somebody, even if they're facing us, we will not get the disease. But if we're closer, and especially if we're very close, for quite a long period of time, perhaps half an hour, and the person who's coughing has got a lot of virus in their lungs, then we're quite likely to get the disease as well. Some people spread more virus than others. So there are some that really do seem to transmit to many others. On average, one person affects 3 others, unless great care is taken to restrict the opportunity for the virus to move. So if we can keep 6 feet away from other people, if we're able to protect ourselves by coughing into our elbows, if we wear a face protector of some kind that's well-fitting and covering nose and mouth, then we can reduce the risk that if we have the disease, we pass it on to others. And if we practice good hygiene, regular hand washing, cleaning surfaces, not touching our faces all the time, then that also can reduce spread. But it is our actions that stop the spread. It's our actions that determine how we will deal with the disease. It's our actions that determine whether others will get the disease. It does depend on us. But we need help. We need strong, community-based health services, the kind that used to exist in many societies, but have been dismantled because many governments have pushed their health budgets into hospitals and they've taken them away from public health. Perhaps now we both know about public health because they're the people who license restaurants and decide whether or not they get a good hygiene rating. But we need community level organization of health services, like a kind of honeycomb throughout the community, to make sure that there are people who can keep an eye on whether or not folk are ill or well. And we need their help, because if we've got symptoms of COVID, we need to be tested to see whether we've got the disease. Of course, if tests are not available, we have to work without tests. We need to be helped to isolate ourselves, to make sure we don't pass the virus on to others. We need help to find our contacts since we started to be ill, and our contacts need to isolate themselves. And in that way, with the support of public health services, we can interrupt transmission of this virus from person to person. And that's what humanity has to be able to do, to interrupt transmission as soon as it starts, to prevent outbreaks from building up. We need to protect those who are particularly vulnerable, older people and people with diseases like diabetes and like high blood pressure or cardiovascular illness. They seem to be most likely to die. But even quite fit people who are in their middle ages, if they get COVID, they can also get quite nasty illness, which can last for several weeks, causing shortness of breath when you do a run or are doing your exercise in the gym. I ask people, if you've got COVID, look after yourself carefully. Not only is the isolation important, but making sure that if you're getting ill and if you're feeling at all short of breath, that you get medical advice. Early treatment makes a huge amount of difference. The people who are most likely to suffer are the people who wait at home a long time before they call for an ambulance and get their help. We've got to, therefore, have community-based health services. Our hospitals need to be repurposed so that they can handle people with COVID in case there is an outbreak that just builds up without us noticing. And if there is an outbreak that occurs in a particular part of the country, authorities are going to have to be able to suppress it quickly. And that will mean restricting movement in the immediate areas. I'd like to stress, third point, that COVID hits the low paid. COVID hits poor communities the worst. The low paid because they often can't take the precautions necessary for physical distancing. They feel they have to go to work, even if they're feeling unwell. And many of the reports of fatalities show that there is a much higher mortality among poorer people and people who have less good access to health services. There's also a higher mortality amongst men. There's a higher mortality in people who live in very dense circumstances like slums or favelas. There's a higher mortality among care workers in residential areas, among workers in meat processing or fish processing plants, because they're cold and they're often very overcrowded. And there's a higher mortality among health workers. But there's also a reality that women face many more problems as a result of COVID and the efforts being taken to restrict transmission. Many countries have imposed lockdowns and widespread movement restrictions. They have very bad effects on people who have got insecure employment or who are in the informal sector. The COVID containment efforts are affecting food systems. Farmers are finding it very hard to maintain their income. And more people are getting hungry and children are getting malnourished. And COVID affects people who are living in really unfortunate circumstances like migrant worker dormitories in the Middle East, and also in ships where crew are often in very close quarters. COVID is revealing fragilities in our social systems everywhere. And if we can pay attention to that, we can work for much better circumstances for everybody, in line with the Sustainable Development Agenda, which, as you heard, was something on which I've worked for a long time. The whole Sustainable Development Goals, I believe, are more relevant than ever. Fourthly, in the newspapers, you're seeing some false choices being put around. there are some leaders who say, we're either going to look after public health or we're going to restart the economy. But I say to them, hang on a bit. The economy cannot restart with any strength if you've not put these vital steps for public health in place. And so it is a false choice. Another false choice is that surveillance is what we're going to have to get on top of COVID, yet we want liberty. And I say liberty will come with a measure of surveillance. These are important false choices. All of us who work in public health have to point out that it's just not one or the other. And then some leaders are presenting mirages to the public. There'll be a vaccine, it will work, it will be safe, it will be available for everybody by the end of 2020. And that will require an extraordinary miracle. We need all 7.8 billion people in the world to be able to have access to a vaccine once it becomes available. It's no good if it's just a vaccine for the rich and the privileged. And that vaccine must be proven to be safe without cutting any corners. Otherwise, the anti-vaccine movement will feel emboldened to fight against it. So I'm saying, let's be honest with people. It's likely to be 18 months before there is a safe and effective vaccine under manufacture. And it's likely to be a lot longer before everybody in the world would be immunized. So let's all learn to live with COVID as a constant threat. And so to my last point, COVID is giving the world an opportunity to demonstrate the power and capacity of the human spirit. We as humans are amazing when we work together and when we combine our forces. This is what we teach in our work on systems leadership. This is the kind of leadership that's needed for the future. Bringing different actors together, helping them to work on issues jointly, and not having any one or other needing to take credit for leading. Leadership is best done in a supportive way that does not lead to individuals seeking and competing to be the one who's shown to have done the best. Instead, it's collective leadership. And collective leadership has to happen in communities and nations, first of all. I'm listening to lots of evidence from around the world. What are the countries that are doing best in dealing with their COVID? Answer, they're consistent on the strategic principles they operate. They're clear on how those strategic principles will be applied in different settings, showing what are the trigger points for changing the strategy to be adopted. And they're transparent in sharing with people why decisions are being made. Just look at how Jacinda Ardern in New Zealand has been communicating in such a clear way with the people of that country. Look at what the president of South Korea has been doing. Or look at the Singapore government and how the prime minister has been taking such a strong leadership role. Look at what Angela Merkel has been doing in Germany. Despite the fact that it's a federal administration, she's been very clear on the strategic principles and the trigger points. And there are other countries where leadership and implementation is inconsistent. And that leads to confusion on the part of people. And it means that they feel extremely disempowered. But then what on earth is happening internationally? This is a problem that is affecting the world like no other issue I've ever seen in my professional life. The people of the world deserve unified global leadership that takes the best of the science that's being found from all over the world and analyzes it, that's working in solidarity in the interests of the people, and that's using evidence to offer solutions that will obviously evolve as we learn more about the virus. But what's happening internationally? For some extraordinary reason that I just cannot understand, leaders, or at least some leaders, seem to have decided that it's best to try to go it alone, and even to create suspicion and animosity with other leaders. We can't have the kind of systems leadership that's required to come through this without world leaders finding the time and the space and opening their hearts so that they work together for the well-being of humanity. And that's where diplomacy really counts. Diplomacy is not simply working for your own position and trying to get the upper hand. Diplomacy in the multilateral setting is working for all people everywhere. The first three words of the United Nations Charter are "we the people." And so I am working constantly, day and night, to try to remind leaders everywhere that competitive leadership within nations and between nations will not empower people to be able themselves to make sense of this present situation and to find their way through this situation in order to have not just what we did have before, because things will never be the same, but to emerge through COVID and to be strong in dealing with other existential threats, whether it's inequity or the destruction of nature and loss of biodiversity or climate change. COVID is a test for us all. It's a test that we can pass, and it's a test that will lead to change. And I say that because I'm encountering thousands of young people, of scientists and academics, of people working in business, and even politicians who do want to work collectively for the world to be a better place as we emerge with COVID as a constant threat, but we're able to get ahead of it and prosper and do well. Thank you very much.
Thank you, Dr. Nabarro. That was amazingly informative and inspirational at the same time. I am absolutely speechless. If I had a microphone, I would drop it and say, wow, we should just end here. Amazing comments. I really enjoyed listening to what you said. Just to introduce myself to the audience, my name is Bill Pan. I'm a professor here at Duke. I'm in the Nicholas School of Environment in the Global Health Institute. I do work on environmental change and human health, mostly in the Amazon, and I've done a little bit in COVID. So just to kick us off on this seminar series for some of the questions, we already have several questions in the text box, and I see we are over 100 attendees here. A lot of things that you said resonated with me, and I'm not going to go over them, but something that I have been struggling with, and it came up actually last night even when I was in a course, speaking in a course about coronavirus. One of the reasons we have this seminar series is to think about the role of science diplomacy in helping achieve partnerships, as you were mentioning at the very end, to create collective collaborative goals. And if I think back about the Millennium Development Goals and the challenges we had to achieving those goals, and you can argue whether or not we achieved them or not, but we made a lot of progress globally in terms of reducing infant mortality, reducing malnutrition, improving maternal health, reducing infectious diseases. But some people have argued that we haven't done that equally across all countries. We've not paid enough attention to things like environmental sustainability, strengthening global partnerships for development. And some of those criticisms led to the creation of the Sustainable Development Goals. And we have largely been guided by some of the gaps we've recognized from the Millennium Development Goals in trying to implement the Sustainable Development Goals. And now that, as you mentioned, with coronavirus, it's highlighted some of the, I think you said, fragilities of our social structures in addressing coronavirus. I'm wondering if coronavirus, both our national response as well as our global response, how does that now change your view in how we should be moving toward achieving the Sustainable Development Goals, not as a whole, but you don't have to talk about them as a whole, but how does that really affect our ability to address these important goals that we made?
Thank you very much, Bill, and thanks for those remarks. I'd like to just spend a few minutes on this issue because not everybody in the attendance may understand these two concepts, Millennium Development Goals and Sustainable Development Goals. And because I was rather deeply involved in both, I'd just like to give you the background. The Millennium Development Goals represented the first time ever that the world had identified a number of targets for domestic and international action. There were 8 of them, and they covered a number of areas, including health, including the environment, and so on. They were very definitely geared towards the needs of poor countries. And I would say to you, Bill, that I did think it was a remarkably successful experiment in targeting action and getting alignment behind a number of finite goals, which could then be studied, and it was possible to demonstrate real improvements in health, in education, and reducing poverty. Now, in 2012 in Rio de Janeiro, world nations met to consider what was their experience of the MDGs and what did they want to have for the period between 2015 and 2030, what was called the post-MDG period. There was a bit of a revolt in Rio where many countries said, hang on a bit, just having goals for poor nations is not fair because rich nations also need to do things, particularly in the area of climate action and environmental sustainability. There was a 3-year negotiation, came up with the new series of goals, 17 of them. Nobody was very happy with that from the the communications community, but that was what came out as a result of an enormous negotiation. And what we see with that particular set of goals is the plan for the future of our world and her peoples. And it's a remarkable plan, and it's encapsulated in something called the Sustainable Development Agenda with 5 principles. People have got to be at the center. Everything's interconnected. Thirdly, if you're going to respond, you should integrate action. That actually the issues are universal. You shouldn't just divide the world into developing countries and developed countries and behave as though the developing countries have got the answer. And then finally, it's all got to be achieved through partnering. I continue to go back to the Sustainable Development Agenda all the time. And I've found that during this period of COVID, the whole principles within the Sustainable Development Agenda, as well as the goals, are still highly relevant. And Bill, I would like to send you a paper that's been written with Joe Colombano, who was involved in the development of the Sustainable Development Agenda, which I think shows this, and I'll try and send it to you immediately afterwards, because I think I'd like to say to everybody, this particular plan and the agenda is very relevant for the COVID reality of now. And I noticed that the Secretary General of the United Nations in a recent report made that point as well.
Thank you for that answer. That's great. Really, if you can send that to me, I would be. I'll definitely take a look. I'm going to hand the questions off to Chris because we only have about 20 minutes left with you, so we want to make sure that we get as many as possible. Chris, go ahead.
Yes, I just have one quick question, and it relates to 2 days ago, the WHO released a manifesto for a healthy recovery from COVID-19. And basically it has 6 prescriptions. Some of them are quite atypical when we look at the statements of WHO. And I will just mention the number 6, which is, the number 6 is stop using taxpayers' money to fund pollution. And I found this quite compelling kind of set of prescriptions. And from what you have said before about a society that has to get ready for the next challenges, a COVID-ready society, how do you see that the role of the organizations and the multilateral system is going to change in order to meet that demand coming from all sectors of society?
I'm so pleased that the World Health Organization came out with that manifesto, making the point that health is an outcome of what happens in so many other aspects of society, whether it is gender equality or access to water and sanitation or equity in terms of employment opportunities. So for me, that document is one of the most important products I've seen out of not just the WHO, but out of the wider UN system for a long time. I think that it's important that all of us, in our dialogue amongst ourselves, in our interactions with people in leadership roles, to say that the reality that comes through us dealing with this new infectious disease is a reality that must also have us making sure that the things that are most important for future generations are properly valued, whether it's valuing nature, valuing climate, valuing clean environments, and making sure that in our valuation we try to stop money being spent on the wrong things and get money spent on the right things. That last point on stop using taxpayers' money to fund pollution is a case in point. There's also a growing request to stop using public money to finance inappropriate agriculture practices that are damaging to the environment or climate or health. And I think that this will have to be the pattern for the future. I'm very pleased to see that some investors, and I'd like to quote Larry Fink of BlackRock, are also saying that investment capital has got to be spent much more wisely so that it does fund activities that are good for people and good for the environment. This will be the future. Will all governments go for it, Chris? I'm not sure. But what I do know is that the younger community, youth community everywhere, is saying, please govern for our generation and generations to come. Please stop just governing for yourself, for the old people who anyway are not going to be here in 20 or 30 years. So all that I can hope for is that world leaders listen to what young people are saying and follow the kind of prescriptions in that manifesto that you described.
Thank you, Dr. Nabarro. A question from the audience. What is the best way to get reluctant politicians to get on board about being more globally focused? In other words, how to reverse increasing nationalism? Easy question.
Thank you very much indeed, Giovanni. Now, let's just start with nationalism and populism. Why has it been possible for political actors, often with the support of lobbyists, to tap in to that sense among so many people in different countries that their interests are not being heeded and that they're somehow missing out? But it may be that those of us who've been committed to global action for many years have made one really inappropriate assumption, that we somehow assumed that everybody was with us and that we did not have to make the case for working for one humanity, and that in our efforts to pursue some of the goals that we were seeking, particularly climate action or action on nature and biodiversity, that we just failed to bring along with us the communities that could easily be encouraged to feel that they were being left out. And I'm sure that things like the Gilets jaunes movement in France had its origins in that sense of being left out. I'm sure that the support for some of the more populist leaders in other parts of the world came from communities who felt that they had paid their taxes and done everything right and joined the military, and then suddenly a load of factories went out of business in their local communities and there was just nothing left. And I think that it was that failure to recognize the sense of abandonment among many, many communities, particularly in wealthy nations, has led to the emergence of a strong populist and nationalist movement that has become so strong, and it is now working against the forces for the common good and for globalization. Now, politicians respond to public sentiment. And public sentiment can, of course, be influenced by clever actions from people who know how to influence public opinion. But those of us who are working for the common future and who are working for the good of all and the well-being of all, we've got to get much better at explaining that that doesn't mean a lot of people have to lose their jobs. There's plenty of work to show that the green economy can actually provide much greater employment, much better employment for people. We need to show that working for the common good doesn't mean suddenly that opportunities that are currently felt by those who are better off are going to disappear. We've got to convince them that it doesn't mean that suddenly energy is going to dry up because renewables are less reliable. And we've got to convince that it doesn't mean that suddenly we're all going to lack access to healthcare because of some redistributive action. So when we are doing our advocacy for global goals, our advocacy for the common good, we have to do it in a way that heeds the anxieties and fears of people who are worried that they're going to miss out. I see no other way of doing it. We have to make our global objectives attractive to nationalists and to local communities. And we've got to learn how to do that quite effectively, because those who are presenting what we do and say as being a threat to the ordinary woman or man have really found some quite skillful ways to put their message across. I could go on talking about this forever, but now I'm going to stop and go back to Giovanni.
Thank you. Bill?
Yeah, so I have another question from the audience. I'm going to slightly reword it based on your comments you just made. A place like the W.H.O, which operates between countries and within countries, has to balance things like US policy versus China policy versus German policy, etc. So given right now that there is growing mistrust in US leadership with China and WHO, and there's a counter argument coming from China, how does WHO navigate that as an organization in order to remain effective?
Thank you very much indeed. Try to be fast now because of time. WHO is a technical organization that is required to set standards for health, to take action for health, and sometimes also to pursue particular campaigns. It's also expected to help the world stay safe in the face of infectious diseases, and every year thousands of alerts are received and are dealt with very quickly. But the way in which WHO works is through a governance structure that consists of 194 what are called member states. They're mostly countries. They set the rules in a diplomatic and political context. There are frequently disputes between them on issues like sexual and reproductive health, or on issues like access to medicines. And they're normally there, and the debates are really quite difficult. But usually there's a resolution to these debates, and then as a result of that resolution, instructions go to the technical secretariat, and the technical secretariat gets on with its job. On infectious diseases, the resolution, which was agreed in 2005 and has subsequently been reviewed almost every 2 or 3 years, says very clearly the WHO has to operate with the information that it receives from the member states. It does not have the power to go in and investigate what's happening in countries without the permission of the national government. And also, the rules state that WHO is not expected to make critical comments about what individual countries do. Now, the Director General and his staff receive information about disease incidents through something called the National Reporting System. They can question and ask for more details, but they can't do that in public. However, quite often, in order to encourage countries to provide more information, they make very positive remarks about what they're hearing. That is the nature of the diplomacy with which we have to operate. There's no bias among the technical staff in WHO. The organization deals with all countries equally, but gives special emphasis to the needs of poor countries. However, there are often disagreements between the member states who provide the mandate. And yes, recently one member state has got very irritated and has said that it's going to withdraw its funding and actually stop being a member of the WHO. This is a total sadness for people like me. I've worked with the United States government and people on pandemic preparedness, on response, on other conditions for many, many years. And Americans are just fabulous in the way in which they contribute to global issues with extraordinary generosity. The United States was very much at the center of the response to the West Africa Ebola outbreak that Chris mentioned. And so the potential withdrawal of United States cooperation and involvement is a great pity. Right at the moment, United States scientists are still working with WHO, and so the organization is doing its best. It's taken a knock because when a powerful member state threatens to withdraw funding, staff immediately worry that they're going to lose their jobs. And this is an organization that receives a budget that's 1/3 of the United States Centers for Disease Control as its annual running costs. We'll go on. WHO will go on. And what we are actually asking is that the American people just ask the government to reconsider and just to wait until we've managed to get through the acute phase of this pandemic, which is affecting poor countries very, very badly right now. And I think that we're just at the beginning of it. It's going to get much worse. So please, if you have any contact with decision makers, just say to them, not now. Do it a bit later. We're all ready to be called to account. I'm sure that there will be evidence that we could have done things quicker or differently. And that's what we expect. There's always after action reviews and we learn. And some of us may get disciplined. And again, we're ready for that. But just wait a bit. It's like taking away half the fire or a quarter of the fire engines when we're in the middle of fighting a terrible fire. We need US support back. We need political support. We need technical support. And then if you want to withdraw it next year when things are calmer, all understood, but not right now.
Thank you. A different question, and given your expertise on food security, the relationship between food security and coronavirus, and your thoughts about how we can make progress on short and long-term food system goals.
This is a time internationally when food systems are getting a lot of attention. The UN Secretary General has planned for a food system summit in September 2021 and has appointed Dr. Agnes Kalibata as his special envoy. It's going to be very exciting to see how, for the first time, it's going to be possible to look at food systems in their entirety in a UN summit process. COVID is revealing so many frailties in food systems, challenges for smallholder farmers who depend on markets functioning, particularly if they're producing perishable goods. Many are having to actually let their produce go rotten or to throw it away. We're seeing that in dairy. We're seeing that in vegetables and fruits, seeing it in fish. Then not only are smallholder farmers in difficulty, but also logistics systems, markets are having to be closed because they've become centers for COVID spreading. And we're seeing just how weak some food system supply chains are and how very, very susceptible they are to supply chain disturbances. And then we're finding that poor people are still finding it hard to get food that they need at a price they can afford. And if food supplies break down, they go hungry quickly. with probably millions of people going hungry right now. So COVID is exposing frailties at the production end, within the supply chains, and at the consumption end. And there's one new discovery, and that is that particular parts of the food system are especially fragile. Meat processing plants throughout the world have become epicenters for COVID transmission, and that's exposing real challenges in the way in which meat processing is done, and that shows that there's work that has to be implemented. So as we prepare for the Food Systems Summit, through dialogues in different locations, through expert action in different places, we are able to use the lens of COVID to expose some serious frailties at the farmer end, at the consumption end, around nutrition, around environmental sustainability. And I anticipate that COVID will become a very powerful force for changing the way in which food systems work, to make them more resilient, to make them bring more benefits to consumers, to make them be fairer to farmers, to make them better for the environment and for climate and for world trade.
Thank you, Dr. Nabarro. I think we have time for one last question. And this is from Mauricio Calderon, who was our first speaker in this COVID-19 Science Diplomacy Seminar Series. And he says, thank you for your insights into science diplomacy. One of the challenges is that scientists and policymakers speak different languages meant to communicate what is deemed important for different interests and audiences at the global and local level. Can you comment on the role of human technology systems for the identification of essential information and intelligence that scientists could share with policymakers for the decision making?
Thank you, Bill, and thank you, Maurizio. I get the gist of your question, but I want to make a couple of comments quickly. You said in the beginning that there's a problem of language. And I think that's extremely important. In my experience of doing systems leadership work, I see 5 qualities that are an absolute must for a systems leader. Firstly, being able to view things from different perspectives. And so that means when you're talking to a policymaker, you have to see things through their perspective and not just always present them from your perspective. Secondly, you have to meet people where they really are rather than where you want them to be. So you have to find where that person is and connect with them there. Thirdly, you have to see systems in the way in which they see systems and not always use your system's map. And that's super important. Fourthly, you do have to really recognize that each politician and policymaker works in their own environment. You have to understand the context within which they're working and not try to impose your context on them. And fifth, you've got to be feeling the rhythm and the pace of what's going on in the politician's life and not present your guidance just simply according to your own internal rhythms. These are all characteristics that I think are key for communication. And I think the scientists on the whole always have to say, how can I come out of my comfort zone and get to where the policymaker is and adapt to the policymaker's location? Now, it may be that artificial intelligence and machine learning will help us to do this. But I also think that an awful lot depends on us as humans, on our ability to work with our emotions, our ability to understand that our connections are best made at an emotional level. I don't have any answers, but I do hope that the one last thing that we can share with policymakers is scientists don't prove things. Scientists disprove stuff. That's what Karl Popper taught us ages ago. And so one of the things that we have to do as scientists is offer propositions to policymakers and expect them sometimes to question those propositions and say, are you sure? And then we go back and we try to actually analyze our proposition. And if we see it's wrong, we go back to the policymaker and say, sorry, we weren't right. That's the best way. It requires a lot of humility and a lot of recognition that we don't have all the answers, but our role is simply to cope with the questions that come from the policymakers and accept that sometimes they'll ask us to go away and think again.
Thank you so much for all of your comments and your time again. I think this will wrap up our seminar. I wanted to wish you a lot of luck in the next several months and years in working, trying to tackle this pandemic, as well as the Sustainable Development Goals, which I am completely in agreement that these are critical goals that we need to achieve. And I think I can say for myself and others at Duke that if there's any ways that we can contribute to this that you see, please let us know, because we're ready to take on any challenges. For the audience, I do want to mention that we will be having a third seminar series on COVID with Pratima Raghuthanan from the U.S. Centers for Disease Control, and with Andres Lascano, who is on the Peruvian Task Force for COVID-19 response. We don't have a date yet because we're still picking a date, but we will let you know by email. But again, Dr. Nabarro, thank you much for your time, and I hope everyone can join me in thank you for joining us.
Oh, thank you, everybody. Duke's a brilliant university system, and the leadership that you show, particularly at this interface area that you're working on, has the capacity to transform. I am so hopeful. I don't give up. I'm never going to give up, because I so believe in the power of humanity. And yeah, things in certain areas are a bit tough right now. But if we keep working, we keep being open, we keep recognizing that we have to get to where other people are, bring more and more people along with us, and they'll be able to bring us along with them. And so thank you for a really inspiring and invigorating, wonderful moment. I'm ready to stay connected with you, and will do through Chris, through Bill, through Giovanni. And with that, I'll dive off because I could just stay here talking forever.
Thank you, Dr. Nabarro.
Thank you so much, Dr. Nabarro.
University. Thank you.
Bye.
Thank you, everyone. Bye.
Thank you, everyone.